So today we're talking about bladder cancer. Why do we need to be talking about this?
Well, bladder cancer is sadly a common cancer. It's the fourth most common cancer in men and the 11th most common cancer in women. There are 11,000 new cases per year and sadly about 4,000 to 5,000 deaths per year because of bladder cancer.
Do you think that's down to the fact the new survey out today kind of really points to that, doesn't it? It's because of ignorance, isn't it, really? We don't know enough about blood cancer, so we're not picking up on the signs and we're not going for treatment early enough.
Yes, I think so. I got my bladder cancer 11 years ago, and I had never heard of bladder cancer, and my symptoms were such that I didn't worry over much that I had cancer. I just had blood in my urine, and I was obviously worried about that because that's not normal. So I carted off to the doctor, and he said, "Oh yes," he said, "you might have polyps. Keep an eye on it, and if it happens again, come back and see me." Well, it was 2 months before it happened again. During that 2 months, things had progressed onwards, and from there it took many other weeks before I was diagnosed with cancer and later operated on.
So what are the signs of bladder cancer? Because this is the whole point of the Be Clear on Cancer campaign that you're supporting. It's getting us familiar with those symptoms, isn't it?
Yes, it's making people aware that should they have a show of blood in their urine, that they should question it. Colin will explain the sort of technicalities of the occurrence, but for any male or female that experiences blood in their urine and they haven't had any injury or are not taking medicaments and living a normal life, and it's a sudden occurrence, even just that, they should go to the doctor and ask the doctor for a full examination. I had no discomfort. I had no other signs, no other symptoms at all. But within my body, of course, cancer was growing.
It took a while for it to be diagnosed, as you mentioned. Your doctor said, it could be polyps, just keep an eye on it. Do you think this campaign, then, Be Clear on Cancer, is important for the medical profession as well? Because obviously doctors are very busy. They're faced with many cases. Do you think they should perhaps, think again about, the signs that are coming through? Perhaps I should be checking for bladder cancer.
Yeah, this is the thrust of our charity action on bladder cancer, that we aim not only at the members of the public, but we aim towards the GPs as well, that the patient should come to the GP and say, "Look, I've got this problem. Would you fully examine me and send me to the clinic at the hospital?" There are they? What's the name of the clinic?
Hematuria clinics.
The hematuria clinics. Most hospitals have got them, and they're formed specially for this particular problem.
Colin, do you find that a lot of people are coming to you and it's too far down the road, so to speak?
It's certainly getting better. There is gradual increase in awareness, but it's frustratingly slow. Of patients who do present with visible blood in the urine, probably only about 1 in 5 of them will have a cancer. So 4 in 5 of them won't, but you can't tell that just by looking at the urine and seeing visible blood in there. So it's important that everybody gets checked out, and a cause of the blood in the urine is found out, whether it's a cancer or, as I say, 4 times out of 5, it's likely to be a benign non-cancerous process going on. So people still need to be checked. The trouble is with the GP side of things is that they probably see an awful lot of hematuria or blood in the urine, because it's fairly common with younger women who have urinary tract infections. But cancer in those group is very rare. Cancer in the bladder tends to come on from the age of 50 onwards.
But it's better to be checked out, though, isn't it? Better to be safe than sorry, as your old mum says.
Oh, absolutely. Yes, because like all cancers, if you pick it up early, it's much more treatable, it's curable, and obviously Tony went down the line of having an advanced cancer when he was diagnosed and had his bladder removed. But we're very much better nowadays in picking it up early and preserving people's bladders, or if we do have to take people's bladders away, we can do a reconstruction of the bladder nowadays. Or patients may have radiotherapy instead of surgery so they can preserve their bladder.
Now, you mentioned that it's particularly more prevalent the older you get, but are there at-risk groups? I mean, when we talk about health conditions on Sunrise, we always get told about at-risk groups, like with diabetes, or members of our Asian community, etc. Are there at-risk groups with bladder cancer too?
The biggest risk factor is smokers or ex-smokers. The thing we don't know about is the passive smoking group, because I'm sure there's a lot of people out there passively smoking for years as well. But smoking is the biggest risk factor, and it's often is smoking in the past, and they always need to be aware that ex-smokers, even 25, 30 years later, can develop bladder cancer. And I know in the Asian population there's a group out there that chew tobacco as well. And certainly they seem to be at risk of developing bladder cancer just because of the cancer-causing drugs in tobacco get absorbed through the mouth or get absorbed through the lungs, and the body's very good at getting rid of those toxins, and it puts it straight out into the bladder.
So we really should be thinking again about, the bladder, really, because with so much of our body, we don't think about it till it goes wrong, do we? Well,
you're right. Everybody as youngsters are quite proud to hang on for 12 hours without having a wee and think it's the best thing ever. You can go out and have 15 pints and not wee for England. But in essence, you're just holding potentially cancer in the bladder for longer. And so it's getting people into the habit of, weeing regularly, taking an adequate amount of fluids on, and stop getting those toxins into your bladder.
Now, you mentioned obviously treatments come on, and supporters come on as well with the Action on Bladder Cancer. You're there to campaign, but you're also there to support, aren't you?
Absolutely, yes. The fundamental thing was just trying to give a very unbiased, comprehensive source of information for people. So it's support not just for the general population of patients, relatives. It's there for the medical profession as well. And what we've done is to set up a very good repository for very up-to-date, matter-of-factual information. Tony, do you want to add anything about the website?
Yes, many urology consultants and radiologists and people like that have contributed towards this website. All the information on it is current. It is very readable. There are no long acronyms and no difficult explanations. But if anybody had any questions about bladder cancer in whatever form, the answer will be on actiononbladdercancer.org.